Hello and welcome to Perspectives on PH. I'm Steve Highsmith. PAH.TV brings you up-to-date coverage of the latest news and information on pulmonary hypertension research and clinical practice. We recently spoke with Dr. Nick Kim from the University of California, San Diego for his perspective on the CHEST-1 study recently reported in the New England Journal of Medicine. I asked Dr. Kim a series of questions about how this data may impact the treatment of patients with chronic thromboembolic pulmonary hypertension, or CTEPH. First, he described how CTEPH is currently treated and why medications are needed for this patient population.
Chronic thromboembolic pulmonary hypertension, or CTEPH, is treated primarily with surgery. The surgery is called pulmonary endarterectomy, also called pulmonary thromboendarterectomy, and was pioneered at the University of California, San Diego. It's a highly subspecialized surgery, but offers a potential cure for these patients with chronic symptomatic pulmonary hypertension. Effective medications are needed in this population due to the inability to operate on many of these patients for various reasons. Most importantly, we feel that all patients with CTEPH with proximal chronic thromboembolic disease should receive consideration for endarterectomy. However, depending on the experience of the centers, as many as approximately 40% of patients with CTEPH are felt to be deemed inoperable due to very peripheral disease. Furthermore, in patients who have undergone pulmonary endarterectomy, anywhere from 15 to 35% of those patients may be left with residual or recurrent pulmonary hypertension after pulmonary endarterectomy. And I think for both these patient groups, those who are deemed inoperable due to peripheral disease, as well as symptomatic patients post-surgery, there is a real unmet need and a need to come up with medical therapies that are effective in treating those patients where currently no treatment is available.
Dr. Kim then discussed the CHEST-1 study design.
The CHEST-1 study was a prospective 16-week randomized, double-blinded, placebo-controlled, multi-center study looking at WHO Group 4, or chronic thromboembolic pulmonary hypertension patients. These are patients who are felt to be technically inoperable due to peripheral disease, or patients with persistent or recurrent pulmonary hypertension after having undergone pulmonary endarterectomy. They needed to have pulmonary vascular resistance greater than 300 dynes seconds centimeter minus fifth, a mean pulmonary artery pressure at least 25 millimeters of mercury, and a 6-minute walk distance at baseline between 150 to 450 meters. The primary endpoint for the study, analyzed at the end of 16 weeks, was change in 6-minute walk distance compared to baseline. Secondary endpoints included, in a hierarchical fashion, change in pulmonary vascular resistance, change in biomarker, namely NT-proBNP, WHO functional class change, time to clinical worsening, Borg dyspnea scale, as well as 2 measures of quality of life. Enrolled patients were randomized in a 2-to-1 fashion to either Riociguat, titrated to a maximal dose of 2.5 milligram 3 times a day, or to placebo, respectively. It's important to note that the patients enrolled were drug naive to any pulmonary arterial hypertension therapy. Patients were not enrolled if they were on off-label treatment with pulmonary arterial hypertension therapy.
Next, we talked about what types of patients were enrolled.
This slide shows the baseline characteristics of the patients enrolled in CHEST-1. You see the majority of the patients were in functional class 3 or 2. Up to 3/4 of the patients were adjudicated by expert surgeons or pre-approved experienced centers as being inoperable based on peripheral disease. Approximately 1/4 of the patients were patients who had persistent pulmonary hypertension after previous pulmonary endarterectomy. Of note, and importantly, all the patients enrolled were not on any background pulmonary arterial hypertension therapy. This is important since at the time there was no approved therapy for the treatment of CTEPH.
Dr. Kim reviewed the results of the study, including primary and secondary endpoints.
The primary endpoint, which is change in 6-minute walk distance measured at 16 weeks, was highly statistically significant in favor of Riociguat, with a total treatment effect of 46 meters in favor of Riociguat versus placebo. The stars represented are for the imputed values, and even with imputation, you see a significant improvement in favor of Riociguat over placebo. The secondary endpoints were also highly statistically significant and were analyzed in a hierarchical order. First was significant improvement in pulmonary vascular resistance in favor of Riociguat compared to placebo, with significant reduction as shown in this slide. There's also significant improvement in NT-proBNP level in favor of Riociguat compared to placebo. There was also significant improvement in WHO functional class in favor of Riociguat compared to placebo, as shown in this slide. When we look at the various hemodynamic parameters measured, again, at 16 weeks, we noted an improvement in cardiac output and pulmonary artery pressure in favor of Riociguat compared to placebo. There was no significant difference in right atrial pressure, pulmonary capillary wedge pressure, or arterial oxygen saturation. There was no significant difference in clinical worsening measured at 16 weeks. We wonder if it's potentially due to relative infrequent nature of clinical events observed in this 16-week time period in this population that is different from pulmonary arterial hypertension.
We discussed adverse events and what was the profile of Riociguat.
Riociguat in the CHEST-1 study appeared to be well tolerated. Over 90% of enrolled patients completed the study, which is always a good indicator of drug tolerability. The most common side effects shown in this slide include headache, dizziness, and dyspepsia, which are similar in frequency as seen in the other phase 3 study, PATEN-1 and PAH.
Finally, Dr. Kim discussed the conclusions of the CHEST-1 study and how it may impact the treatment paradigm for patients with CTEPH.
CHEST-1 study was a landmark study. This was the first time a medical therapy has been shown to be effective in improving exercise tolerance as measured by 6-minute walk distance, as well as other clinically meaningful secondary endpoints in patients with inoperable chronic thromboembolic pulmonary hypertension or those patients with persistent pulmonary hypertension after pulmonary endarterectomy. Riociguat, therefore, is the first medical therapy approved for this indication of patients in WHO Group 4 or chronic thromboembolic pulmonary hypertension. Riociguat represents the first approved therapy in the treatment of chronic thromboembolic pulmonary hypertension for patients with inoperable distal disease, as well as those patients with persistent pulmonary hypertension after pulmonary endarterectomy surgery. This drug fills an unmet need within CTEPH, as the only therapy we have currently available is pulmonary endarterectomy surgery. And depending on experience and availability of these centers, not all patients with CTEPH can undergo endarterectomy surgery. Therefore, there was a real unmet need in coming up with effective, well-tolerated therapy for this patient population.
That was Dr. Nick Kim from the University of California, San Diego. Thank you to all of the experts who contributed to this edition of Perspectives on PH. We look forward to seeing you here at PAH.TV as we cover the latest news in pulmonary hypertension.